Welcome to this short introduction to e-portfolios in midwifery education. In healthcare education, learning does not only take place in the classroom. Some of the most valuable learning experiences happen in practice, while working with real patients and under the supervision of experienced professionals. In this presentation, we will explore what an e-portfolio is, why it is increasingly important in healthcare education, and how it supports the development of future midwives. During this presentation, we will cover 4 topics. What is a portfolio? Next, we will look at the different types of e-portfolios that exist. Then we discuss the specific requirements of portfolios used in healthcare and medical education. After that, we will see how e-portfolios are typically used in clinical learning environments. An e-portfolio is a digital environment where students can collect evidence of their learning and professional development. Traditionally, portfolios consisted of paper documents stored in folders or binders. Today, digital portfolios allow students to store learning experiences, assessments, reflections, feedback, and achievements in one secure online location. An e-portfolio is much more than a digital archive. It helps students demonstrate their progress, reflect on their experiences, and take ownership of their learning journey. Digital portfolios offer many advantages. Students no longer need to carry paper documents or worry about losing important records. Everything is available online and can be accessed anytime and anywhere. An e-portfolio provides a clear overview of progress, achievements, assessments, and feedback. It allows students to review their development over time and identify strengths, as well as areas for improvement. For supervisors and faculty members, it creates transparency and supports informed decisions about student progression and competence. Healthcare education has unique requirements. Learning takes place in real clinical environments, often under time pressure and in complex situations. Students perform many different clinical activities, receive frequent feedback, and gradually earn greater responsibility. A medical portfolio must therefore be easy to use, highly structured, and capable of collecting detailed information about competence development. It should provide clear dashboards, support feedback processes, and contribute to trustworthy decisions about readiness for professional practice. After performing a clinical activity, a student may open the portfolio and complete a self-assessment or request feedback from a supervisor. The supervisor reviews the activity and provides comments, ratings, or recommendations. All information is stored centrally and immediately becomes available for analysis and reporting. Over time, these individual learning moments create a comprehensive picture of student development. Many healthcare programs traditionally relied on paper logbooks to document clinical experiences. These logbooks often contained records of procedures, assessments, and supervisor signatures. By moving these processes into an e-portfolio, institutions gain greater efficiency, better data quality, and improved transparency. Students also benefit from a clearer overview of curriculum requirements and completed activities. In healthcare professions, trust and competence are critically important. A final grade may indicate academic performance, but it does not tell the complete story. Educators need evidence that students can apply knowledge safely and effectively in real clinical situations. This requires a much richer understanding of performance than a single examination result can provide. E-portfolios help capture that broader picture. For that reason, a medical portfolio collects more data throughout the program to build a clearer picture of each student. Each data point can be an assessment or feedback on a clinical activity. Supporting EPAs and modern educational frameworks, many healthcare programs use competency frameworks or entrustable professional activities, often called EPAs. These frameworks focus on professional tasks that students must eventually perform independently. Because educational models continue to evolve, a modern e-portfolio must be flexible enough to support different approaches and requirements. This adaptability helps institutions align assessment with their educational philosophy. Healthcare professionals are busy. Students, supervisors, and clinical staff do not want technology that creates additional administrative work. A successful medical portfolio integrates naturally into existing workflows. It should be fast, intuitive, and available whenever feedback needs to be recorded. The goal is to support learning without disrupting patient care or clinical practice. Let us now look at some examples from a dedicated midwifery portfolio. The portfolio is organized according to the structure of the educational program. Students can navigate through different years, modules, or practical learning phases and easily access the assessments they need to complete. This creates clarity and helps students understand their learning pathway. Within each section of the portfolio, students can access assessment forms and workplace learning activities. These forms are designed to capture meaningful information about clinical performance and professional development. Feedback can be documented directly within the system, creating an ongoing record of growth. One of the greatest strengths of an e-portfolio is its ability to transform learning activities into meaningful insights. Dashboards provide students, supervisors, and faculty with an overview of progress, completed assessments, feedback trends, and competency development. This information supports coaching, mentoring, and decision-making throughout the educational journey. The final example shows how progress can be visualized through reporting dashboards. Institutions can monitor practical experiences, completed hours, assessments, and other program requirements. These dashboards help ensure that students remain on track and provide evidence for accreditation and quality assurance processes. E-portfolios have become an essential component of modern healthcare education. They support workplace learning, facilitate meaningful feedback, improve transparency, and provide a richer understanding of competence development. For midwifery education, they offer a powerful way to connect learning, assessment, and professional growth. Thank you for your attention. For more information, please visit Scorion.com.